Good day, everyone. Welcome to our next module, module 11A. And here we'll be discussing ways to be safe and save energy and time. Now, we are bringing three keywords into consideration here. Safety, saving energy, saving time. In anything you do, keep safe first. Then how do we save energy and also how do we save time? So how does this apply to us as home health care aides or personal care aides? We need to understand the basics of keeping ourselves safe as well as our patients, and also helping to save time and what conserve energy. That's saving energy. Now, previous module we discussed about cleanliness, how to care for the home and personal belongings. And then we made mention of something that has to do with safety as well as what being free from infection. So we'll still be talking about safety, and in addition to that, saving energy and saving time. So without wasting time, we'll move to the introduction. Using proper body mechanics is of utmost importance. And what is proper body mechanics? Proper body mechanics means using the body in an efficient and safe way. And when we talk about body mechanics, we're just talking about postural safety or ensuring that your body is being used. You are using your body in the efficient way and in a safe way as possible. So here we are considering our health as home health aides and personal care aides, because there is no way we can dispense effective healthcare services when ourselves are not healthy. So using proper body mechanics prevents a home health aide or a personal care aide from injuring ourselves or injuring the patient. Pass safely, and it should also encourage our patients safe alone. We are also making what ourselves safe. So we show a patient safe ways of doing things and a good body mechanics. Remember, using proper body mechanics helps to prevent injury, and this applies to both home health aides or personal care aides and the patient. So now we are picking maintaining proper body mechanics as a subtopic on its own. So what proper body mechanics is, we said body mechanics is what the right way to use your body safely and what efficiently. So how do we maintain a proper body mechanics? Now, when standing, keep your feet about a hip width apart, about 12 inches apart. And this provides a strong base of support and balance for you to walk. When you want to stand, the different kind of standing, when you stand and your legs are together like this, these are your two legs, assuming these are your two legs, and your legs are like those, cannot be measured as compared to when you are standing like this. I don't know if I can see my hand clearly. So stand what? Hips apart, like 12 inches apart, to provide a strong base support for yourself. So always bend your hips and knee when lifting at the waist and overextending your back. And as the picture we'll see after this, let's see if you can go there quickly. For example, so when you want to lift an object, you don't bend your back, you bend your hip. So we see in the pictorial representation. So going back to what we are discussing, always bend at your hips and knees when lifting or stooping, instead of bending at the waist and overextending your back. So you use the larger and stronger muscles of your thigh hips, of your thighs, or of your hips, of your shoulders, and of your upper arm while bending or lifting objects. So this protects your back and your smaller muscles from injury. When you are holding heavy objects close to you, holding objects, you hold them but close to your body when lifting or carrying them. When you want to carry, don't carry everybody like this. You bring them close to your body, you lift them close to your chest. Then turn your entire body in as you are doing. Don't carry uh, uh, things like this. Rather, turn to it and carry. Always make sure your face, your chest, and your stomach, as well as your thigh, is facing whatever loads or tasks you are performing. There's an example here. Correct way of sitting. Pictures may look small. We need to zoom in and zoom in for our for better visibility. You see, bad way of sitting, correct way of sitting. So in whatever you do, you make sure that your back is straight. Like, don't ever have a condition whereby you need to bend your back extremely, because when you bend your back, your in the vertebral column will get fractured. If fragmentation below the shoe, so this is what is saying why body mechanism. So remember, good posture. Keep your back and your trunk straight and aligned with your hips and your head facing forward towards the direction you are walking. And this prevents twisting, which increases your risk of injury. Always raise the bed to waist height. Always raise the bed to waist height. Who is in bed. So don't always bend down to bed. Rather, allow the bed to be at your weight. But when pushing a load, this one leg forward. Then when pulling a load, move one leg backward. So provide you with a stronger and a more stable base of support. Sorry for the breathing. communication. My network was bad, so I had to come to the login. So quickly, let's go back to where. So we're talking about proper body mechanics. Good. So I hope you can see me clearly. So we talked about remembering what good posture to keep your back and front straight. And also we stopped that when you are lifting a patient in bed, you always seek for help. You are not a superman, like I said, so always seek for help. Have others help with lifting or moving heavy objects. Do not perform tasks that will be physically dangerous for you or for which you may not be physically capable of. Keep in mind that when you are moving a patient, the path or direction in which you are moving must be clear of objects that could get in the way and cause potential injury. Imagine you lifting a patient or wheeling the patient or moving a patient, you could, and there is an obstruction of path or in your path, it could get you injured as well as what your patient to work with the brakes on the bed and the wheelchair before transferring the patient, because this prevents was the bed or wheel from moving and causing potential injury to you or to your patient. Now, time management. Remember what we started with our topic, ways to maintain what? Safety, save energy, and what? Save time. So time management. Prioritizing and staying organized will help a home health aide or personal care aide to make all the most efficient use of their time and energy. As much as we are using our time and energy, we are to dedicate our time to the patients, give them time, permit them, don't rush them, help them. We are not to waste any of our time. Waste in what sense? If you don't make the most use of time, you waste time, and then as well as wasting time, you also waste energy. Like in some households, home health aides or personal care aides may only be required to do a few household tasks, and for other households, there may be several tasks for them to complete. So it is often helpful to make a list of tasks that must be done. Now, always following the care plan and perform the task that the care plan states. So if a patient asks a home health care aide or personal care aide to perform a task in which they are not comfortable, they should use the words a good communication skills they learned in this course to speak with them about it. And if one can seek guidance from a supervisor concerning the matter. So we know that we are not so independent in our activity and base of our dealings. We have a care plan and a guide and a supervisor to seek guidance from. So there comes in any condition, any case, however, that makes you uncomfortable or necessitates you to do beyond what the care plan asks you to, you seek guidance and supervisor and learn to communicate with your patient. Good communication skills. We've learned this so far. So the good communication skills we've learned in this module should be used effectively to prevent you from offending your patient and as well as offending yourself. The next thing is a pictorial a presentation of how we can manage our time, be organized, delegate authorities, prioritize authorities, be proactive, be focused, and have a to-do list. So home health aides or personal care aides must or should encourage their patients to assist and perform tasks as they are able. We've said repeated times, countless of times, that we are not to take over the lives of our patients. As much as they are unable to do some tasks, there are varieties of tasks that they are able to do. So what do we do here? We help them, encourage them, assist them, ensure that they perform tasks that they are able to do. Mind the word able. The tasks they are able. Do not force them to do beyond their strength. or beyond where their strength lies, you give them the opportunity to do what they are able to do. So within those people, may be able to perform many tasks. This will help promote their self-esteem and independence while also efficiently using time. So imagine you want to take care of a patient and you have an hour to complete the varieties of tasks. Now, the division of labor makes time efficiently used. When a patient could do something for himself, you could put them through and allow them do it while you do others. So if you look at it, by the time you've divided the labor, that you have saved a lot of time. But if you want to single-handedly do everything, then you are not using time efficiently. So you document the time it takes to complete task on the care plan and never document a task that was completed before it was done. That is what malpractice. So you should never document a task that was never completed or that you document that is completed the task before you have done it. No, no, no. So when a patient is carrying out their task, document how long it took the patient to do that task. And then when you are also trying to complete your own task, document was how long it took you to complete your task. Always remember that providing a personal care to the patient is the first priority of a home health aid or personal care aids. And you must never neglect or ignore a patient's needs in order to complete a household task. Now, as long as we are task-minded, time conscious, never on no account neglect the needs of your patient to complete a household task. That task can wait. The patient comes first. So it's helpful, however, to learn to plan time and prioritize tasks in order to complete all the tasks that is required. Then you make a task list. Making a task list on a piece of paper uh, helps a home health aid or personal care aid to what? To be able to carry out those tasks efficiently. So on a piece of paper, a home health care aid will write down all the things they must complete during their time in the patient's home as the care plan directs. So look at all the tasks that must be completed during the week and during the month. Some items may only need to be done once per week or once per month. So make a task list. You look at the tasks that comes up every day. The tasks that come up every day, they be prioritized. The tasks that come in once a week, maybe once in a month, twice in a month, or as thereby. So you have a task list for us to itemize all the tasks and the how frequent those tasks are what needed to be done. When you prioritize the task, now prioritizing tasks means that you are placing one task over the other in place of what importance. For example, it's more important to focus on meeting a patient's needs, such as eating and toileting, than to do household chores such as laundry and vacuuming. So, home health aides or personal care aides can learn to prioritize by using several methods. So here we'll discuss the ABC method and the 1 to 10 method of what? Prioritizing patients' needs or tasks. The ABC method first. A, tasks are important and urgent at all times. The A tasks are important and urgent at all times. The B tasks are tasks that are important but not urgent at this time. A tasks are important and urgent at this time, at this particular time, while B tasks, they are important but they are not as urgent at this time, while C tasks, they are not important and they are not urgent at this time. So we must understand those that are urgent and important currently at this time, those that are urgent but not so that are important but not urgent at the time, and those that are not important and likewise they are not urgent at the time. So after making a task list, you go through it and mark which items will be in the A category, B category, or the C category. So those that are marked A should be completed today, immediately. Once they are completed, move on to the tasks that are what marked B, important but not urgent at this time. The tasks that labeled C can be completed as time allows. Remember, though, just because the task is marked C does not mean that it should not be completed. So it gives you a longer period of time, or it gives you space to perform the more urgent task than the lesser urgent one. So it may just have to be completed at a later time, not that it will not be completed. So an example of a task listing from ABC method is, now look at tasks that happens to fall under A. A tasks are providing patient date, that is urgent and important at this time. Cook and feed for breakfast, they are important and urgent at this time. Help a patient with scheduling doctor's appointments. These tasks are what urgent and what important at this time. For laundry, laundry is important but not so urgent. Making the patient bed is also important but not so urgent. Mopping the kitchen or the floor is also important but not so urgent. Now, look at the C group now, C category, clean out refrigerator. Of course, it is not important and it's not urgent, but it is necessary. Necessary. So organize linen closet, not important, not urgent, but they are necessary. Then vacuum living room, not important, not urgent, but necessary. Then grocery shopping is also necessary, but not what important and urgent. So all these ones can be done at later times, at leisure periods, when there is no task that is hanging. Now, the 1 to 10 method. Prioritizing the 1 to 10 method tasks. Now, tasks that are most important are marked 1, are ranked 1, while the least important are ranked 10. So you see, ranking them from what? High priority, from the highest priority to the what? To the lowest priority. So while the least important tasks are ranked 10, now task lists can be organized by priority number or label, the priority number. Remember, patient needs and preference will indicate what items will need to be made priority. Now, this is an example of a 1 to 10 method. So, example of task listing 1 to 10 is patient base, fall under what? Task 2. Now, they are not even arranged properly. We have listed out our task: patient base, making patient bed, laundry, mopping the kitchen floor, clean out the refrigerator, cook and feed for breakfast, vacuum the living room, grocery shopping, help patient with scheduling doctor's appointment, organizing enclosure. These are 10 tasks to be done. So now we start to what? Label them per their priority. If you look at taking a bath or cooking and feeding for breakfast, which one comes first? Of course, food comes first. And after food, you can take his bath. From there, you can schedule this meeting and appointment for the doctor, the doctor's appointment. Then from there, we can talk about making the patient's bed, then maybe laundry, then mopping the patient's floor, then maybe grocery shopping as number 7, then vacuum the living room as number 8, the clean out refrigerator as number 9, and organized method as number 10. And this is not we are not limited to this. How do I put it? It is we have a room to change this depending on the patient's need. So in a case whereby patients need to all patients' clothes are dirty, but you made the bed yesterday. When you are making a task, you don't put the patient bed first before laundry. So their laundry will come first before patient's bed. So these are marked based on what patients need, but there are some needs that cannot be what negotiated. Like food will always come first ahead, then bathing, then the lights can come after. You can't, no matter how the patient needs are, helping the patient to schedule the doctor can never come last. So keep that in mind. The 1 to 10 method. So what is the tip for efficient time use? The tips for efficient time use. How can we efficiently use time? When you conserve time, you as well as what? Conserving energy. And when you waste time, you're also wasting energy. We have some tips for home health aides or personal care aides that make the most efficient use of their time. Number 1 is to break down larger jobs into smaller tasks. We said every great journey starts with what? A step. Good. Now, sometimes some things may look so big, but they are not actually that big. They're not so big. So when you break down tasks, just assuming that you want to clean the whole house, it looks so so big and broad. The whole building, the living room, the kitchen. But we can break it down to smaller tasks. But now let's start with the most important part of the home. Then, so you know, when you break your task down, you see that you will achieve it in a less time than trying to capture everything at once. To be flexible and be realistic. It is not always possible to get everything done that is on your task. That's on your task list. Sometimes unexpected situations can come up, so complete the highest priority task first. Like I said, split down your work, prioritize them, which one comes first. Start with the one that is very important. So if anything even comes in between completing your task, at least you've done the most important ones already. So be flexible and realistic. Don't always think that you have 500, you have 20 tasks to complete and you can do that within 2 hours. That is unrealistic. So always be realistic. Then revise the task schedule as needed. Instead of going grocery shopping, which takes a longer amount of time, you may need to what, instead be able to do a task you intend to complete later in the week, which takes less time such as laundry. So rather than going shopping, you can decide, okay, this shopping will take my time, and uh, you can go for, to save time, you can go for what, those that take a lesser time first, then attempt to want to take longer time later. Then you do two things at once whenever possible. Now, do things at once whenever possible. There are some things, there are some chores we cannot combine, whereas there's some chores that at least can be combined to save time. So this will help you to make the most efficient use of your time. For example, you can put laundry in the washing machine and also to cook for the patient and also bathe the patient. So while the machine is working and those are cleaning, what, you provide the patient's bath and also you cook for the patient. But by the time you are done with these two tasks, the washing machine should also be about, getting rounded up. Then you complete that task. So within a short period of time, we're able to what, clear out three different tasks: washing that laundry, bathing the patient, and also preparation of meal. So whenever possible, you can group tasks that can be done in the same place. This helps to eliminate what, unnecessary steps. Imagine you want to the dishwasher and you want to wash the dishwasher and also you want to cook at the same time, and as well as you also want to, okay, let's stay with those two. You want to cook and want to wash dishes. Of course, this can be done in the same place. So what do? We what, eliminate the two at the same time by what, grouping those tasks. So after giving a patient a bath and changing the bed linens, you can gather up all the dirty laundry that is in the room at the same time and use the laundry the basket or the hamper to help to us to make the most of the time and energy. So when you are done, you take all the clothing at one time to the laundry area, and rather than making several trips, take you pack the best, you take the laundry, you come back, you take this, you take it, then you come back. So it wastes your time. You can use a basket or a hamper or a bin to pack everything at once. So reduce or minimize amount of steps you take. It's really manage time. So when you are cooking, make more than 1 meal at a time and free some for use for later time. Instead of cooking, some people may not be able to. Let us know that you have patients who requires a lot of care. You may not be able to do breakfast and also do lunch and also do dinner. So in the morning when you have the time, you can do breakfast, lunch, and dinner. At least breakfast could still, if it remains for lunch, that's fine. And you can also do dinner and what, you refrigerate them. So when it's time for dinner, you just have to what, to warm them, without using the the stove, whatever it is, to warm the food. So you can just heat them up and they are good for meal, for eating. So instead of cooking a small batch of meal, you can cook a larger quantity and freeze them into smaller portions. Be economical with patient supplies also. Now, being economical means being mindful of waste. Use only the necessary amount of cleaners to get the job done. This avoids what, waste. Now, let me cite an instance. If you pick one person should clean a room of, let's say, a hall, considerable wife, a considerable call with a normal wife, it takes a longer time to complete. When there are two, getting better. When there are three, all right, it's getting better. When there are four, fine. But when then 20 or 30 in a hall to make the offering, you will see that they will even waste more time than 5 persons would literally have done. What happens? When you have too many unnecessary amounts of cleaners getting a job done, it increases wastage of both time and resources. So get the necessary amount of cleaners to get the job done. Not too small that the job will that you have to overwork them, and not too much that the job will be lagging and wasting and the waste resources and materials. You can use baskets and hampers and grocery bags or trays to help carry several items at once. Now, this helps to reduce the number of steps you must take to complete a task. However, be careful not to overload yourself or to carry too much at once. So, as reasonable as possible, carry as much load as you can cope with at a time so as to limit or reduce the amount of steps to take in completing a task. So, you keep supplies organized and in one place. For example, cleaning supplies should be stored in the kitchen sink in a secure cabinet, while cooking utensils, keep each supplies in a place together so as what easy accessibility and for easy usage. You can use proper tools for the task to be completed. Know how to use the tools currently correctly and in a safe way. For example, using a chef knife instead of a stick knife for chopping food. Using a chef knife makes it safer for you than just using a stick knife for chopping food. So clean as you go. Clean as you go. Some people will love to complete their task. They will work, maybe in the kitchen, they will prepare food, prepare soup, prepare this. Now pack all the pots, pack all the plates, pack them, keep all of them and keep them up, then start washing. No. Clean as you go. As you are cleaning, if anything spills on the ground, you wipe it up immediately before it dries. But when you get dry, you now have to now start with incurring stains or having to use other stain removal equipment or materials or chemicals to work to wipe the stains. So clean the pot as we go, clean the ground as you are done with this, wash them and make them set back in its place. And finally, cleaning stains is often time consuming while bearing food. Of course, so cleaning the preparation to keep your space clean and clutter free. This will help you to organize and save time on the long run. I repeat, cleaning stain is often time consuming. So while bearing food, you clean your preparation to help keep your space clean. Number one, it doesn't only make you hygienic. Imagine you are cooking food and your soup is littered all over some soup when they are boiling, littered against the wall, against the ground, and just left it like that. It even makes the place irritating and it looks less hygienic. Immediately you will see that there are any stains on the wall or on the ground, and then you clean them, you wipe those things as you go. So when you clean in while preparation of food, when you are done preparation and preparing food, you see that everywhere is clean and clutter free. So this will help you to organize and save your time in the long run. And remember to always use proper body maintenance. I repeat, remember to always use the word proper body maintenance. Injury costs us pain, costs us time, costs us money. So protect your body. Thank you for your time. Have a wonderful evening.